Look at what you gave your child for breakfast this morning. Not the calories, not the sugar, the color, the bright red in the fruit snack, the electric blue in the cereal, the orange in the crackers. Those colors did not come from strawberries or blueberries or carrots. They came from petroleum, the same raw material used to make gasoline, plastic, and motor oil, refined into a synthetic dye, added to your child's food, and served on a plate in your kitchen. The FDA Commissioner said it himself on April 22, 2025, in an official press announcement, "Petroleum-based food dyes have no nutritional benefit." His exact words. The agency responsible for the safety of your family's food called these dyes nutritionally worthless and acknowledged that parents and doctors have concerns about them in the same statement where they announced they would ask companies to stop using them. Ask, not require. Ask. I want to show you what the science actually says, why it took decades for any regulatory body in the United States to say it out loud, and what you can check in the next 60 seconds that will change how you read every food label for the rest of your life. Here is the number that should have changed everything, but did not. 2007. A peer-reviewed study funded by the British Food Standards Agency, the UK equivalent of the FDA, gave children a mixture of artificial food colorings and observed their behavior. The children became measurably more hyperactive. The increase in hyperactivity was observed not just in children with existing attention difficulties, but across the general population of children tested. Neurotypical children. Children without any prior behavioral diagnosis. The study was rigorous enough that the European Union acted on it immediately. Within 2 years, the EU required warning labels on any product containing 6 specific artificial dyes. The label reads, "May have an adverse effect on activity and attention in children." You have never seen that label on an American product. Because in the United States, that warning was never required. The same dyes, the same study, 2 completely different regulatory responses to identical evidence. The 8 dyes that the FDA announced it was phasing out in 2025 had been in American food for decades. Some of them since before most of the parents feeding them to their children today were born. And in that entire time, while the EU required warning labels, while 25 states introduced legislation to ban them, while the science accumulated study after study, the answer from the federal level was, consistently, the same. Not enough evidence to act. I want to explain what not enough evidence actually means here, because it is the key to everything else in this video. You may have already seen coverage of this topic that said, food dyes do not cause ADHD. That is technically accurate and deeply incomplete at the same time. ADHD has genetic and biological roots. Food dyes do not cause it. What the Southampton study found is more specific. Artificial colorings can worsen behavioral symptoms in children who already have ADHD and produce measurable hyperactivity in children who do not. A follow-up paper estimated that approximately 10% of the behavioral difference between children with and without ADHD could be attributed to artificial dye exposure. 10%. In a condition that already affects how children learn, form friendships, and sit in classrooms. The children consuming these dyes every day had no warning label. Their parents had no information that would have allowed a different choice. That information existed in the scientific literature. It was acted on in Europe, Canada, and Australia. In the United States, the response was asking companies voluntarily to consider a change. This is the story of how a system designed to protect your family's food decided, decade after decade, that the evidence was not quite sufficient to require action. The FDA's standard defense of artificial food dyes rests on a threshold argument. The agency classifies a substance as safe when there is no established causal proof of harm at typical exposure levels in the general population. Under that standard, the Southampton study was significant but not definitive. It showed association, not causation. It showed behavioral change, not a clinical condition. It was strong enough for Europe to act, but under the FDA's higher evidentiary bar, not strong enough to mandate removal. This is not a cover-up. It is a philosophical difference in how 2 regulatory systems treat the same evidence. The EU applies what is called the precautionary principle. When credible evidence suggests possible harm, especially to children, you act before definitive proof accumulates. The FDA historically has applied a different standard. Established harm must be demonstrated before mandatory action is taken. The problem with the FDA's approach, applied to something added for purely cosmetic reasons, is this. These dyes have no nutritional function, no preservative effect, no taste contribution. They make food look brighter and more attractive, which makes it sell better. When a substance has no function but possible harm to children, the precautionary case for removing it is very strong. You are not trading off a health benefit. You are trading off a color. That calculus changed in 2025. The FDA Commissioner said in the April announcement that the agency was asking companies to stop using these dyes as part of a broader effort to address childhood chronic illness. The word petroleum appeared in the official statement. After decades of the evidentiary bar not being cleared, the bar moved. Here is what the chemistry actually shows, because the behavioral research gets most of the attention while the molecular evidence gets almost none. A 2025 study examined what red dye 40, the most widely used artificial food coloring in the United States, present in 14% of all products sold by the top 25 U.S. food manufacturers, does at the cellular level. The study found that red 40 causes DNA damage, gut inflammation, and microbiome disruption in mice fed the dye under conditions designed to approximate normal dietary exposure. DNA damage, not just behavioral change, direct damage to the genetic material inside cells in an animal model. This is the same category of evidence that led the FDA to ban red dye number 3 in January 2025, the first time the agency had banned an artificial food dye. Red number 3 caused cancer in lab rats, not humans. Rats. The FDA acted. The 2025 Red 40 study has not yet produced the same regulatory outcome, but it is a meaningful escalation in the evidence base, from behavioral studies showing attention effects to cellular studies showing DNA damage. The trajectory of the science on red dye 40 is beginning to resemble the trajectory on red dye number 3, except that red 40 is in far more products and has been consumed in far larger quantities for far longer. The EU does not permit red 40 in the same formulations that US manufacturers use. European versions of American brand products, the same Skittles, the same Fruit Loops, the same Gatorade, use natural colorings derived from beet extract, spirulina, and paprika. The products look and taste the same. The manufacturing cost is slightly higher. The difference is regulatory philosophy and the commercial inertia that philosophy protected. Here is what I want you to hold in your mind for a moment. The companies producing these products knew, not that the dyes were definitively harmful, but that the European versions of their own products, made for consumers in countries with stricter standards, had already been reformulated without synthetic dyes. They have been manufacturing, in parallel, a version of their product that does not contain petroleum-based colorings, specifically because regulators in those markets required it. Mars reformulated Skittles for the EU market years ago. Nestle removed artificial colors from its European product lines before the US announcement. Kellogg's uses natural colorings in its UK cereals while using synthetic dyes in the US versions of the same products. These are not different companies. They are the same companies making the same products, choosing different ingredients based on what different regulatory environments require. This means the technical problem was already solved. The ingredient substitutions that the FDA is now voluntarily requesting companies to make by 2027 have been commercially viable and operational in other markets for years. The delay in American reformulation was not a chemistry problem, it was a regulatory problem, and the regulatory problem persisted for as long as it did because the cost of changing was borne by manufacturers, while the cost of not changing was borne by children. I want to say this as clearly as I can, because this channel's credibility depends on not softening what the evidence actually shows. 8 petroleum-derived synthetic dyes have been in the American food supply, in products marketed specifically to children, for decades. The EU required warning labels on these dyes in 2009. That requirement was never implemented in the United States. In the years between that EU decision and the FDA's 2025 announcement, the dyes continued to be added to breakfast cereals, fruit snacks, sports drinks, candy, and children's medications. A 2025 study found that red dye 40 causes DNA damage in animal models. The FDA banned red dye number 3 because it caused cancer in rats. Red dye. Number 3 was a small fraction of total artificial dye consumption. Red dye 40 is a much larger one. The FDA's announcement was not a ban, it was a request. 22 companies committed to removing petroleum-based dyes by the end of 2027. That commitment is voluntary and subject to the same commercial pressures that have governed this category for 50 years. The children eating these products today will be eating them until 2027 at the earliest. No one put a warning label on the cereal box that told you any of this. The practical intervention here is more straightforward than it has been in any prior episode of this series, and it is available to you at the grocery store right now. Read the ingredient list on anything with an artificial color. Look for the following: red 40, red 3, yellow 5, yellow 6, blue 1, blue 2, green 3, citrus red 2. These are the 8 dyes the FDA announced it is phasing out. Their presence on a label tells you a product was formulated with a petroleum-derived synthetic colorant for which the company chose not to substitute a natural alternative, even though in many cases they are already using that natural alternative in the version of the same product they sell in Europe. The alternative products are not specialty or premium. Most major product categories now have versions using natural colorings. Annie's, Horizon, and most organic certified brands do not use synthetic dyes. Several conventional brands have already reformulated ahead of the 2027 deadline. When a label says colored with fruit and vegetable juice, or colored with beet extract, or colored with spirulina, those are natural colorants not included in the phase-out. For parents specifically, one practical note. Children's medications, including liquid antibiotics, certain vitamins, and over-the-counter children's medicines, frequently contain synthetic dyes for the same cosmetic reasons as food products. Checking the inactive ingredients list on any liquid children's medication for FD and C dye designations is a low-effort, high-impact intervention that most pediatric pharmacists will confirm is entirely reasonable. Here is what happened in February 2026 that has not yet received the coverage it deserves. The FDA approved a new red food coloring derived from fermented beetroot, not from petroleum. It is produced by a biotech company using a process that generates a natural pigment stable enough to replace red dye 40 in most applications. The FDA approved it as a food coloring additive in February 2026. It is the first natural red colorant approved with the stability profile needed to replace synthetic reds at commercial scale. The FDA does not fast-track the approval of a natural colorant replacement unless it expects that replacement to be needed. The science of natural coloring alternatives has reached commercial viability at the exact moment the regulatory will to require the switch has materialized. These dyes are being phased out because the alternative is now viable, the evidence has accumulated long enough, and the regulatory system has concluded that the cosmetic benefit of synthetic colors does not justify ongoing exposure of children to petroleum-derived dyes for which a natural substitute exists. That conclusion took about 50 years longer than the evidence warranted. The replacement ingredients have been approved. The companies serving stricter markets have been making the switch for years. You now have the label vocabulary to make that same switch today without waiting for 2027. Look at that food label again. The one you have never read all the way through. The one that looked like a chemistry assignment. Find the color. Find out where it came from. If it is red 40 or yellow 5 or blue 1, you now know what that means, where it comes from, what the science says about it, and what to pick up instead. That knowledge did not appear on the package. It was not in the television advertisement. It was not part of any official consumer communication from the companies that have been using these ingredients for 50 years while reformulating them out of their European products. It is in the published science and the regulatory record, which is exactly where this channel looks every time. If you want the next label read for you, subscribing is how you get it. I will see you in the next